It's the middle of the night and you are in dire need of medical attention, but the nearest hospital is almost an hour away.
That is the reality for thousands of Virginians every single day. 10 News reporter McKinley Strother shows the work being done to change that.
Standing here on US 460 at the edge of Roanoke City in Roanoke County, I'm about 15 to 25 minutes away from the two closest hospitals. But here in Patrick County, in some places, you can be 35 to 45 minutes, even an hour away from the nearest hospital. And not to be dramatic, but as the Wilsons recently found out, whom you're about to meet, that can be the difference between life and death.
Drink it, see if you can get it up.
The simplest of tasks, like drinking water, not so easy anymore for the Wilsons.
They miss it when it's gone.
What they didn't know, and most don't really think about, how much your zip code matters. But the couple found out Mother's Day weekend.
About 1:30 in the morning, he woke up and said, "This is a heart attack."
She dialed 911. It would be almost an hour, however, before her husband makes it to the hospital.
We were lucky.
The Wilsons live in Patrick County, a county with no hospital. They can travel 37 minutes to Martinsville or across state lines to Mount Airy, North Carolina. They went to Mount Airy. So you're in a position where no matter where you go, it's a distance.
It's at least 40 minutes, 35 miles in either direction. And then if you want to go west, then you get to Galax, and that's farther.
Patrick County is one of 7 counties in our area the Virginia Department of Health lists as persistent recruiting challenge areas.
It's a rural area, and rural hospitals are closing.
In a 2016 report, many areas in Southwest Virginia received high scores as shortage areas.
The more recent, the 2021 report, talks about all of the scholarships and all of the various opportunities that there are to increase access to primary care services.
Since then, some things have changed, but it takes time.
So different states have these rules where in order to open up something, you need to apply to the state to get a certificate of need. And that's certainly the case in Virginia.
Since the 2016 report was released, that hospital that was only 10 minutes from the Wilsons closed in 2017. This is that empty lot today.
We may not be able to change the distance, but can we continue to improve on the system by which those highest acuity cases get to the specialty centers, the tertiary care centers, in the shortest period of time?
The Virginia Department of Health is addressing these concerns with the Virginia Rural Health Plan.
Trying to be where people are.
I talked with Lewis Gale and Carilion Clinic, 2 of the largest employers in our area.
I think the pandemic caused people to leave healthcare.
Undoubtedly, the COVID-19 pandemic has everyone paying just a little bit more attention to their healthcare needs, but it's also created challenges for healthcare providers.
In the deep rural areas, it's a little harder.
Harder to get employees there, but work is being done. Carilion has several initiatives to tackle this issue, like the Blue Ridge Partnerships for Healthcare Careers and their new YES program. It also has its medical school, which brings medical professionals like Dr. Andrew Moore back to our area.
I grew up in rural Washington State, and my heart in serving patients was always to serve a rural population.
Lewis Gale will soon open this freestanding ER in Blue Hills. The system is also paying attention to its employee needs.
It is critically important that we fill our nursing vacancies so that we can better serve our community.
But expanding their reach again will take some time. Now let's get back to the Wilsons.
It took 15 hours to find a bed for someone that doesn't have that kind of money, you know.
It's tough.
Yeah.
It's tough. Thankfully, Mr. Wilson is better, and their elected officials tell me that at least an ER should open there by the end of the year.
We can increase awareness through stories like the one that you're doing, McKinley. We can empower people to at least be aware, to understand that there are unintended consequences of living in rural areas, and there's beauty too. But if you're aware of some of the potential threats to your health, then at least you can take some steps, have a plan in place.
McKinley Strother, 10 News, working for you.